Welcome to the Health Collective, your reliable source for all matters health and wellness. We are your trusted advisors in this vast world of health information, dedicated to shedding light on various health conditions, promoting overall wellness, and debunking health myths. Our commitment is to provide accurate, comprehensive, and accessible health-related content, empowering you with knowledge for a healthier life. Today we delve into a condition that affects many women globally: endometriosis. So, what exactly is endometriosis? That's a question many have asked, and today we're going to unwrap the mystery. Endometriosis, in the simplest terms, is a condition where the tissue that normally lines the inside of the uterus, the endometrium, grows outside it. A little confusing, isn't it? But let's break it down. Normally, this tissue, the endometrium, thickens, breaks down, and bleeds with each menstrual cycle. But when you have endometriosis, this tissue can't exit your body during menstruation. Instead, it becomes trapped, leading to a myriad of problems. Endometriosis is more common than you might think. It affects 1 in every 10 women during their reproductive years. That's a considerable number. But despite its prevalence, it's often misunderstood and misdiagnosed. Why? Because its symptoms often mimic other conditions, making it a bit of a medical chameleon. And here's a critical point to remember. Endometriosis isn't just about physical pain. It can also have significant psychological and social impacts. It can affect relationships, work, and overall quality of life. So it's not just a women's issue, it's a societal one. Now that we have a basic understanding of what endometriosis is, let's talk about its symptoms. This deeper dive will help us better understand this complex condition and the significant impact it can have on the lives of those affected. Endometriosis presents with a variety of symptoms. Each person's experience can vary widely, which makes this condition a bit of a chameleon in the medical world. However, there are some common symptoms that many people with endometriosis share. One of the most frequent symptoms is painful periods. This isn't just your regular menstrual cramps. We're talking about intense, debilitating pain that can interfere with daily activities. It's a pain that's often described as sharp, stabbing, or even similar to labor pains. This pain can start a few days before the menstrual period and continue for a few days after. It's more than just an inconvenience. It's a significant disruption to one's life. Another common symptom is pain during or after intercourse. This can be a sensitive topic, but it's important to discuss because it can severely impact relationships and personal well-being. This pain can range from discomfort to severe pain, and it's often felt deep within the body. Heavy menstrual bleeding or bleeding between periods is also a common symptom. This can lead to anemia, which in turn can cause fatigue and other health problems. It's not just about having to change your tampon or pad more frequently, it's about the impact on your overall health. Infertility is another symptom that affects many people with endometriosis. About 1 in 3 women with endometriosis have difficulties getting pregnant. Endometriosis can cause damage to the ovaries and fallopian tubes, making conception challenging. This can be an emotionally draining experience for those trying to start a family. These symptoms can significantly affect the quality of life. They can impact your work, your relationships, your mental health, and your overall well-being. It's not just about physical pain, it's about the ripple effects that these symptoms can have on all aspects of your life. Recognizing these symptoms is the first step towards getting the right diagnosis and treatment. If you're experiencing any of these symptoms, it's important to talk to your healthcare provider. There are treatments available that can help manage these symptoms and improve your quality of life. Remember, you're not alone in this, and there's help available. But what causes endometriosis? This is a question that has intrigued medical science for years. Let's delve into the primary theories that explain the possible origins of this condition. Firstly, we have the concept of retrograde menstruation. This happens when menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity instead of exiting the body. These displaced endometrial cells stick to the pelvic walls and surfaces of pelvic organs, where they grow and continue to thicken and bleed over the course of each menstrual cycle. Next, we have the transformation of peritoneal cells theory. In this case, experts believe that hormones or immune factors promote the transformation of peritoneal cells, cells that line the inner side of your abdomen, into endometrial cells. Thirdly, the embryonic cell transformation theory suggests that estrogen may transform embryonic cells, cells in the earliest stages of development, into endometrial cell implants during puberty. Another theory revolves around surgical scar implantation. After a surgery, such as a hysterectomy or C-section, endometrial cells may attach to a surgical incision, a phenomenon known as surgical scar implantation. Lastly, we have the immune system disorder theory. It's thought that a problem with the immune system may make the body unable to recognize and destroy endometrial tissue that's growing outside the uterus. These theories offer a glimpse into the complex nature of endometriosis. However, it's important to note that no single theory explains all cases. Some women may have a combination of factors, and some theories may explain the cause in some women, but not in others. So, while we continue to explore the mysteries of endometriosis, it's clear that multiple factors, including genetic, hormonal, and environmental influences, may play a role in its development. While the exact cause is unknown, these factors may increase the risk. Let's continue our journey of understanding endometriosis by exploring the different treatment options in our next segment. Although endometriosis can't be cured, there are treatments available to manage its symptoms. Keep in mind that every patient's journey with endometriosis is unique, and so the treatment approach must be personalized to fit each individual's needs and life circumstances. A fundamental treatment option is pain medication. Over-the-counter pain relievers such as ibuprofen can help manage the pain and inflammation associated with endometriosis. However, these should not be viewed as a long-term solution, especially without professional medical advice. Next, let's talk about hormonal therapy. Hormones play a crucial role in endometriosis, as they can stimulate the growth and activity of endometrial tissue. Hormonal therapy, such as birth control pills or hormonal IUDs, can help to regulate or suppress the hormones that contribute to endometriosis. This treatment may reduce pain and slow the progression of the disease. Conservative surgery is another treatment option, but it's typically considered for severe cases or when other treatments haven't provided sufficient relief. This type of surgery aims to remove or destroy the endometrial tissue without harming the reproductive organs. It's important to remember that while conservative surgery can provide significant relief, it doesn't guarantee the complete eradication of the disease or prevent it from recurring. For women who are struggling with infertility due to endometriosis, assisted reproductive technologies, such as in vitro fertilization, can offer a path to pregnancy. IVF can increase the chances of conception, but it's not a treatment for endometriosis itself. Remember, these are just some of the treatment options available. The choice of treatment should be made on a case-by-case basis, taking into account the patient's symptoms, age, desire to have children, and overall health. Remember, it's important to discuss these options with a healthcare provider. They can provide valuable insight into the benefits and risks associated with each treatment option, helping to guide the decision-making process. A consultation with a medical professional can help determine the best course of action for each individual. The journey with endometriosis may be challenging, but with the right treatment plan, one can effectively manage the symptoms and lead a fulfilling life. Endometriosis is a common yet often misunderstood condition. It's a medical enigma that affects 1 in 10 women globally, yet it remains shrouded in mystery. We've ventured through the labyrinth of endometriosis in this video, shedding light on its symptoms, causes, and available treatments. Let's revisit the key points. Endometriosis is a chronic condition where tissue similar to the lining of the uterus grows outside of it, leading to a myriad of symptoms. These symptoms can include painful periods, pain during intercourse, discomfort during bowel movements or urination, excessive bleeding, fatigue, and even infertility. However, it's important to remember that the severity of symptoms doesn't always correlate with the extent of the disease. As for the causes, while the exact origin of endometriosis remains elusive, several theories float around. From retrograde menstruation to immune system disorders and even cellular transformation, the root cause is still a subject of ongoing research. What we do know, however, is that factors like family history, menstrual irregularities, and never giving birth may increase the risk. When it comes to treatments, there's no one-size-fits-all solution. It's a tailored approach based on individual circumstances. Options range from pain medication and hormone therapy to conservative surgery, and even hysterectomy in severe cases. Yet, it's essential to remember that while treatments can manage symptoms and improve quality of life, there's currently no cure for endometriosis. In the face of such a complex and often daunting condition, knowledge truly is power. Understanding endometriosis, its symptoms, causes, and treatments is the first step to tackling it head-on. It's about being proactive, seeking help, and advocating for your health. And that's what we're all about here at the Health Collective, empowering you with the knowledge to make informed health decisions. If you found this video helpful, don't forget to subscribe to our channel for more enlightening and informative content. Remember, knowledge is power. The first step to tackling endometriosis is understanding it. If you found this video helpful, don't forget to subscribe to the Health Collective for more informative videos. Stay healthy and informed.